Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut. We are excited because we are going to do a series here, and the name of that series is going to be Filler Faces and When You're Ready for More. So we're going to kind of get into some pre-facelift, when you're ready for a facelift, and then we're going to do a facelift, a full facelift podcast. But before we get into that, we want to
This is the prequel.
This is the
before we get there.
Before we get into that, we obviously want to thank Rejuvime Medical, your anti-aging clinic, for all things longevity, HRT, hormones, peptides, GLP-1s, aesthetic injectables as well. We're all over Louisiana, north, south, east, west now, and creeping into Mississippi and the Gulf Coast. We also want to thank Weiler Plastic Surgery Group, Louisiana's largest plastic surgery practice with 5 board-certified plastic surgeons, a million, basically, amazing injectors led by yours truly, Taylor Besh. And then, of course, all of the estheticians that kind of keep us with that glow and skin health and everything. But as you can probably see, we're missing somebody, but we have gained a wonderful individual. This is her second time being with us, right? Second. Dr. Gear, thank you for joining us.
Of course.
Mary Gear in the house.
I know.
Missy.
Y'all know we get a little wild when it's all female.
Yeah, right?
I'm like, when we're not regulated.
Don't have to hold back.
I know. So, Dr. Gear, thank you so much for joining us. And I mean, you love a facelift, right?
Well, I mean, I love faces.
Okay, that's what I would say.
Everyone's got one.
Everything.
Everybody's got one.
Everybody's got one.
She is the one surgeon in our practice who does both. So I think she's the perfect person to be here. So she'll do Botox, dermal filler, skin, all the way to a deep plane facelift. So she sees the gamut of every patient, every step of the way
that you can do. Before we get into it, Dr. Gear, tell us a little bit about yourself for those who missed that first one, because you, ma'am, are an amazing lady. I don't know how you do it. I just don't.
Like I told the nurses recently, sometimes I take a break and cry in my closet, and then we stuff it all way down deep and roll on.
Just keep on trucking.
So I'm a plastic surgeon. I'm from Baton Rouge. I'm a mother of 7 if you count my stepdaughters. The late child to 2 physicians. Former art major.
Artiste. You should see her artwork. It's amazing.
Wait, you paint things?
Oh, no, you have no idea.
Oh, really?
Brittany.
There's a few hanging in some of the offices.
Is there really? I'm going to have to go see it. I love art.
We have to put it on the
Just
screen.
do some B-roll of some art here.
We can make that happen.
I love, because I'm always looking, like when you're always looking for art pieces for your house. And it's just, I feel like that's one of the most difficult things to kind of pick for you.
Yeah. No, it's good.
I'm going to get a commission piece by Dr. Gear.
I think it goes hand in hand with what I do and why I like plastic surgery.
You're an artist.
Truly.
I like to think so.
An artist of the body.
Yep.
It is.
An artist of the body as well.
Ironically, I paint mostly
bodies. Mm-hmm. Yeah, it is. It's naked bodies or like silhouettes. It's beautiful.
Yeah. It's not the only thing.
How long have you been practicing?
Love this.
Let's see, since 2018.
Okay. Wow.
Okay.
Yeah. And 10 years of surgery training prior to that.
Before that.
Mm-hmm. General surgery, plastic surgery, hand surgery. And, but really my practice since I started has grown, and face is becoming a bigger and bigger part of it. And I think once you have patients that are around for several years, everyone has a moment, even people who think they never want to do toxin, they never want to do fillers, they're never having facial surgery. They all have a moment in time where there's a breaking point for most people. I was thinking about it, like, what are the patients that I see? And there's a couple different distinct ones, but the one that I've heard over and over again, and I even remember my mother saying it back in the day, is the new grandmother in her 50s or so whose grandbaby reaches up and grabs their neck. And,
Yes.
and if they can talk, if it's the
Yes.
if it's the toddler that says, Nana, what is this? It's a deal breaker. They all
Done.
come in and they're like, I didn't think I cared,
But I care
but
now.
get rid of this like tomorrow.
Now I feel terrible because I used to go up to my grandmother and hit the bottom of her arm.
Oh yeah, the back of the arm. Oh
She's
yeah,
like-
it's the best.
She's
Or
like
when
90.
they hold you, just rub it.
I hate that. Like, don't touch me. I love you, but stop touching me right
it's
now.
like, I'm gonna need you to remove that. Just nope. That's
Mom, why are you so squishy? Just don't even look at me.
it's just like, well, I hope you enjoy your new life with your new family.
Right.
And come back later. That'd be great.
The beauty of Weiler Plastic Surgery and Dr. Gear is that, say when I tap out, when I can no longer manage a patient, she can no longer make a patient, just strictly injectable patient, happy, is that we have everything
Yes.
from a CO2 laser to a Botox needle to dermal filler to collagen to a facelift. And that is in-house. I had a patient recently. I started treating her with Botox and filler in Hammond 15 years ago. And literally last month, she just had a facelift with Dr. Weiler. And it was just so special because we had a conversation like, okay, you want an unattainable goal. In my hands, I cannot meet that. But I know a guy. And, the trust was there. She knew that we would be involved in the process the whole way. And so it was special, full circle,
I think the hybrid approach is really important, and you don't get that everywhere.
Yeah.
I see people all the time that just kept doing and doing and doing things that are yielding little to nothing in
Right.
return, or even causing troubles because they're with someone who doesn't have any other tools in the toolbox.
Yeah.
You can only inject so much. There's still a role for all of those things, injectables and toxins and skincare, as part of the journey, even after facelift, but it's certainly not the solution at a certain point.
Right.
Yeah, like sometimes you just have to say like enough's enough. Like
Yeah.
it's not going.
You either have to accept that this is the new version of you going forward. You can't fix these things, or you have to step it up to the next level, which is usually surgery.
Yeah.
So I want you to talk
like,
about
let's go to the beginning.
basic aging face.
Right.
And I want, Dr. Weiler always gives a great description. I want your take on just the anatomy changes, what happens to the skin, the bone, collagen.
Yeah.
Kind of give us
The
that
ratio thing.
Yes.
Like he always talks about like the thirds
yeah.
and whatnot and having everything equal out appropriately.
I don't know all the Weiler
I know.
isms, so
Look.
I have to give you the Gearisms.
I know. I want the gearisms.
I like,
yes.
girl,
We're here for it.
I have learned the good, the bad, and the ugly isms that come from this man.
So faces age in a rather predictable fashion. Obviously, it's different for everybody, and there's distinct types of anatomy, and it can be more accelerated. Unfortunately for women, perimenopause and menopause kick everything into high gear, and we know that there are these sort of moments in time where you do age a lot faster. So that's why all of a sudden at 45, you come in and you're like, I don't know what happened. Like, I didn't look like this 5 years ago. But that's just one part. But the big thing that's happening with aging is not just to your skin, it's to the underlying structures as well. So I always point out to people that the facial skeleton is actually being absorbed over time. It's thinning out. The orbits get bigger, the cheekbones, your zygoma is reduced, the mandible is reduced, which is why we're always hitting those particular areas with filler.
Yeah.
But when the foundation is going, that's what allows a lot of this soft tissue descent that you see. It's not just your skin being stretched out over time. So it's literally sliding off the foundation. So that's why the first step, especially in younger patients that come in, is restoring the foundation. And when the foundation goes, you start to see things that you didn't know were there. Their anatomy that was always there, but as it slides and volume we do lose, especially the deeper fat compartments in the face, they become deflated. And so when you lose those malar fat pads, you're losing the bone, everything just goes south, and then everything that is a tethering structure, these ligaments in our face,
Is also affected. Yeah.
when you start to see them.
Yeah.
So that's why you start seeing an exaggerated tear trough. You start seeing this lid to cheek junction that's not smooth. And you start seeing, nasolabial folds and marionettes and jowling, that scalloped appearance to the border. That all happens in a kind of predictable fashion. It's just a matter of how significant it is.
Mm-hmm. I love how you said underlying anatomy. It was
Yeah.
always there.
Mhm.
It's
Yeah.
just the supporting things around it have
You've
changed.
lost that. It's like, you've lost the covering.
Yeah, that's
And now
so
it's
good.
just, it's kind of
And then what about
showing
collagen? That's the big,
Ew. the C
Yeah.
word.
So, I mean, the collagen in our skin and our dermis is doing nothing but leaving us almost from the get-go.
Just a bad relationship.
Yeah, really, in your early 30s, you start seeing a significant decrease in that, and that doesn't improve over time. And there are things we can do to improve upon that. Some of the tried and true ones, the vitamin A derivatives and lasers, those are all things that I feel like everyone needs.
Yeah.
But it's a constant battle, and there's nothing that's going to stop it. So that's the number one thing I tell my patients. There's nothing I can do to you that time and gravity aren't going to change.
Right.
Yeah.
So
good.
It's a matter of whether you want a full court press from now until one day you say, I have to prioritize something else, or people want to be one and done, but it's really hard to do anything that's a forever thing.
Yeah. Without surgery.
Mm-hmm.
I mean, which isn't forever either, but much longer lasting.
For sure.
Which reminds me of the death becomes her. Like, unless you have, the potion to drink.
Yeah.
Is that the one where they live forever
Yeah.
and they all like destroy each other in the process? Yeah.
Yes, the one had a hole.
Mhm.
Goldie Hawn had a hole,
Yeah.
and Meryl Streep's head was completely turned around.
That was
such a. And Bruce Willis was the mortician that would just like paint them appropriately. But yeah, I mean, I do feel like a lot of people are chasing that fountain of youth. They're trying to find that, and I do think with what y'all do is great. It's like you can give them a touch of that fountain of youth. Bringing back volume in different places, and I mean, you full spectrum doing it from start to finish.
I think of filler and toxin as like a gateway drug.
It's 1000% a gateway drug.
It's a gateway drug to surgery. Because at some point, surgery becomes the less invasive, the less risky, the more predictable,
and sometimes
outcome.
Financially.
I know.
I mean, what people invest in, in injectables
it's a lot.
Yeah, absolutely.
Now,
I want to know this. I wonder, we're starting Botox and filler much younger.
Mhm.
We're starting skincare much
starting
younger.
everything
We're starting
younger.
lasers much younger. What is that going to do to the face? Because you just said it, it's the gateway. So they are being introduced younger. They're taking better care of their skin. But are we going to see facelifts
earlier,
or is it going to be longer because they're prejuvenation and they're preventing, right?
I think it can go either way. You're going to see better facelifts. You're going to see better results because people's skin quality is so much better when they come to us.
Oh, that's a good point.
Yeah.
But you're still not, you're not affecting the underlying facial skeleton and the changes that happen there.
Right. Yeah. So, I mean, I would say starting off 20s, we see patients for Botox, some dermal filler, and you're recommending vitamin A and lasers, right?
I mean, it depends on the patient,
Yeah.
right? In your 20s, if you're young, you're
Let's say
healthy,
ish.
protect yourself from the sun.
Yeah.
Number one,
Yeah.
recommending really good sunscreen. There are, early, I'd be lying if I told you I didn't have a teenage daughter that was already on vitamin A derivatives.
Love it.
But it's because it works.
Yeah.
That's what I tell you. The
Yeah.
problem with Botox and skincare is it works.
Yeah.
But you
Yeah.
Is
can't.
she doing it
stop-
more for acne or more for prevention?
Both.
Yeah.
It started off as a little kind of acne-prone skin, but then you start seeing such nice, pretty skin.
Right.
You want to keep it up.
Right.
But you have to be, religious in protecting your skin from the sun
Yeah.
and
Yeah.
being adherent. And not just some adults can't do it, much less
Right.
teenagers.
Right. Right.
But to loop back on younger faces, I think the stigma is gone, at least
Correct.
for
Yeah.
most.
Correct.
So, and I don't know if that's just the nature of where we are in 2026. I think a lot of it is social media. And the stigma around facelift is gone. In fact, I think it's becoming almost like it used to be, how do I avoid a facelift or how can I put off having a facelift for as long as possible? And now it's just tell me when I need a facelift.
Right.
Yeah.
So-
I do
Which is
think
a comfortable conversation, honestly.
Yeah.
It's true.
So I want to ask, like, so when y'all are starting with these like filler patients, when someone's coming in, and I know y'all do the assessment for like the full facial, just full face balancing here. Like, let's take a look at it. Is there a point like when somebody's coming in and they're like, I want filler and this is what it is. And Taylor, you just look at them and you're like, oh,
What do you mean?
That's
this is what it is?
unrealistic.
Oh,
Every day.
Every
Yeah.
day.
Every day.
Do you,
yes.
it's like people are thinking that that's going to fix.
Yeah,
and
absolutely.
it's like, oh.
I say in my hands with this dermal filler, you have an unattainable goal, but you are so lucky because I have amazing plastic surgeons that can talk about the next step. And they're like, we're not ready for a facelift yet. Okay, then let's backtrack and see what is an attainable goal. Majority of them will have a consultation with their surgeons and just hear, because I don't want to create something that I can't, an unhappy patient, right? And what they're asking for. I had an 89-year-old lady the other day.
Oh, Sha.
Beautiful, precious, but what she wanted versus, and it was this. It wasn't just like a little.
It was like,
right.
Pull it back.
Right.
And she's like, get it, girl. And you're like, well.
Right.
So, how are those? I know we did an episode and I totally wasn't here for it, but liquid facelifts. I know we did that, back many moons ago.
Yeah.
But is that the next step prior to, are you doing a full-blown liquid facelift prior to doing?
Take us to break real quick and then
we'll
let's come back and talk about just continue the aging process and the stair steps, because that would be coming. Yeah.
That would be coming. All right. Hang around. I was about to say stick tight. That's not,
stay tuned.
Stay tuned. I was like, stick tight. Just like the skin on your face after a facelift.
Yeah. High, tight, and right. So we like everything here at Weiler Plastic Surgery.
That's so good.
Oh my gosh, I want it high and tight.
I want high and tight. I need everything to be high and tight. So hang on 1 second. We'll be right back with Taylor and Dr. Gear, and they are going to let us know what are our next steps and what the next part of the aging process is.
My name is Casey. I live in Hammond, Louisiana. As I was approaching my 30s, I started to notice a few wrinkles here and there. I just wasn't happy, so I decided to make a step to change it. I've always known of Dr. Weiler's practice, and that was always my first choice. The first time I've ever been here, I was a little nervous, but once I got there, everyone was very welcoming, made me feel at place, and it's made me look visibly younger. I have more of a confidence boost. I feel better about myself and in my own skin.
My name is Josh Hughes. I'm 43. I'm currently on the HRT program. I just started feeling the effects of getting older, being tired all the time, not motivated, sore when I would do physical activity, and just needed a change. I've been on the HRT program for around 3 years. Within the first month, I completely noticed a huge difference in my mood and energy. The weight that I had gained started to drop off rapidly. It just gave me a new lease on life. It made me feel like I was in my 20s again.
All right, we are back for the high and tight talk. That's what we're going to call it, the high and tight talk.
Yeah. It applies to pretty much everything I do.
That's what it is. Everything's high and tight. I love that. I just like, it's so fantastic. Okay, so what were we talking about? We were talking about
just like the progression.
The progression.
So now we're in our 30s.
Yeah. So
we've been doing 30s. A little Botox, using skincare.
Yeah. So here's what the 30-year-old comes in and complains about. I don't like this line right here, or I don't like my tear trough. And this is the delicate part, I think, at least for me, with any plastic surgery patient, injectable patient, is explaining to them what they want is not what they need. So they come in and are like, I want just a little filler here, or I want, X, Y, Z. And it's like, well, you have all that because of the deflation of this malar fat pad, and now this is descending, and then it's giving you the appearance of all these things, and we talk about what your options are.
Right. Yeah. So you're saying it's like, it's not so much this, like, well, we're going to have to like lift. Like we're going to have to
This is the symptom.
This is the symptom. It's not.
This is the problem.
Yeah. It's like the tear troughs and the lines. That's not going to be your
Everyone
issue,
has a tear
right?
trough.
Yeah.
Your little bitty baby's got a tear trough.
Yeah.
But it becomes exaggerated when you deflate the fat around it.
It's the balloon. Just,
It is.
Okay, so what are you doing
like
to
so
treat that?
true.
So what are y'all doing to treat that? Like what's our first line for your 30-year-olds that are coming in?
Well, this Taylor can answer this better than I can, but it's mid-place volume replacement in the overwhelming majority of them.
Correct.
They start to get this kind of predictable deflation here. If you look really more from the profile, I mean, these are youthful, attractive people. You look at them from the profile and they have a little flat spot here that's kind of like almost a little upside down triangle. You can point it out, and that's what's gone, and it allows this to just come down a little bit, get some.
But the first thing
tired.
is we don't want big fat cheeks.
I know.
And we're like, no.
That ain't gonna do it.
that is not what we want either.
Yeah.
We just want to restore the natural volume that you had to kind of re-drape your tissue.
So when we're talking about cheek filler and that mid-face, you know, like this to help kind of like lift everything up, is this like one syringe? What's on average, like what people are getting for that mid-face to kind of
I would say average in your 30s is probably just for mid-face 2 to 3 syringes, because part of your mid-face, I always say, is your temple. So this area, this is the hanger, and everything kind of is draped down around it. So for addressing the C, which is the eye, the orbit, what she said, we're losing that support. The orbit is, you know, that is getting bigger, and you see this more than the temple and that cheek junction. All this needs to be addressed with dermal filler. So, and that's easily done, honestly.
People get really hung up on syringe numbers.
Correct.
It's a CC.
I know.
Correct.
I'm like, I feel like we should have brought one to like
Yes,
press out to
we
see
should have.
exactly how much
I try to,
is in it.
I think it really helps to talk in terms of teaspoons or tablespoons. So a teaspoon is 5 cc's.
Yes,
So a teaspoon is 5 syringes, people.
People,
That's nothing.
when I tell
It's-
people that I have 5 syringes of filler in my face, they're just like, and I'm like, it's fine. It's totally fine.
Yeah.
It's like a drop in the bucket
Yep.
to this bad boy.
Yeah, but that is, I think all of my patients have heard that 5 syringes is a teaspoon.
Not a tablespoon, to be very
yeah.
clear here. We're talking teaspoon.
Yeah, it's very, and that doesn't do what it needs to do in some patients. And that's when you have that conversation that like, okay, the next step would be, and we were talking about on break, we can fine tune things and lift some things with HA filler, which Dr. Gear was just talking about. But then I would say more prevalent on the market, at least compared to 15 years ago, is collagen stimulation. So done with CAHA, calcium hydroxyapatite, or PLLA, which is Sculptra, polylactic acid. And that in combination, when we're still trying to buy that time before the surgical, so combining that, I would say, is your next stage of life. And that is, you know, your 40s. That's when you're really seeing the collagen start to kind of go down and more. She said 30s is this, which is spot on. 40s is I feel heavy, especially with so many people on GLP-1s.
It's what is
Yeah.
And
what
it's
is this?
Yes.
Yeah.
Are you doing a lot of jaw filler?
And a little bit of this.
And that, okay,
Maybe
that's
like-
me. I'm 41. Hello. I'm like, what is this? So it keeps changing a little bit, right?
Yeah.
Jaw filler, yes, but what you were talking about earlier is more of the facial balancing. You said that before break. So that is placing dermal filler in the right spots. And you call it facial balancing, I would say, is because you're not talking about an amount, or
No.
you have the trust of the patient to put the product in the exact places that they need. And it's not so much this product here, this amount, this. You're doing a pan facial, putting a little product wherever they need it to soften and lift.
The whole thing.
Now, with that, you can do the Sculptra. And Dr. Gear said, you know, she feels that is the best product to help with skin turgor. And that's the thickness and kind of the actual skin is improved with that. So kind of expand on
you were
that
saying
a little
you can
bit.
put it it's getting to where you can kind of.
It's not formally indicated for anywhere. Let me
Shut
just
up,
But that's
Brittany.
okay.
let me
This is
just
not
let me rephrase.
We're just talking about trends that are out there currently.
Yeah,
That's
so-
it. That's all we're doing.
I think what we're talking about is that biostimulatory effect, and do you get collagen induction with these products? And you do, probably for different reasons with each product, but I think that's pretty well described with Sculptra. So talking about the history of Sculptra, I think puts it in perspective. So this drug was originally indicated for HIV-related lipodystrophy changes in patients that were medicated. They got this kind of stereotypical wasted appearance. They would lose a lot of the fat in the face and the temples. So I always like to look at drugs like that have come along who we treated sick, immunocompromised patients with. And then it translated into the aesthetic market. And then I think kind of was there in limbo for a long time, used by some, and then for reasons I don't totally know, maybe you know better than I do, has really been popularized, almost like
Well, you
rebranded.
remember that it was just a pain because you had to mix it 48 hours before.
Yeah.
You got nodules.
Yeah.
The mix, we would go through probably 20 needles because it would clog. So I think it is more of just they rebranded because they had a better constitution. And once you could mix it immediately and inject it immediately with a better constitution with no clogging, I think that the result was there. It was a pain in the butt. Dr. Weiler injected it back in the day. And we would have to have it ready 48 hours before. If you didn't use it, it would. So it was more so that rather than
it just wasn't user friendly.
PLLA. Yes, it wasn't user friendly.
Well, they came back with different instructions, I think, on how much to reconstitute it with. It's more dilute. It makes it more user friendly. I think it's effective in very small doses. But I think the issue with Sculptra is patience. Not the people, but having patience with the process.
Oh, yes.
Because it relies on the body's response to it and kind of this auto augmentation. But I'm using it more and more. I think it's really effective. But I think you can dilute it and safely use it in different planes in the face. There's a lot of very prominent injectors that do that.
Now everyone needs to stop, go back, watch the Sculptra video that we did. Watch it because it kind of really gets into Sculptra and everything about it. I know Lauren was the one who had.
You have a great memory.
So good.
It's like she does this for a
Yeah,
living.
right.
It's almost like I was 4. No. I know Lauren did the Sculptra episode, and she kind of really gets into. I know Taylor, once again, another one that I was on vacation for.
Yes, so good.
I need some more currently, especially on this side. Right?
I was about to. After this, I was going to say, when are you injecting me, please?
It's like while you're here.
Okay, keep looking at your.
I keep trying to get on your schedule, and you're too busy.
I'm sitting here staring.
I cannot stand it.
This is what happens when you start filler in a timely fashion.
In a timely fashion. See,
I mean,
took
seriously.
care of it.
Yeah. You are good with skin.
Mm-hmm.
Do you do enough lasers? I don't.
So no, and it's really just a function of time and trying to find a moment. But I think, and that's an important. Your skin is the number one thing that gives you away. I tell my patients all the time, and there's a good study. Don't quote me because I can tell you who, but it looked at what other people see in faces and what makes someone appear old. It's not wrinkles, it's not lines, it's your skin tone and texture. So if you can avoid or get rid of brown spots and age-related changes from sun damage and appear dewy and glowy, your skin looks youthful. Even if you have lines or jowls or other changes, it's perceived as youthful. So I tell all my patients, if you're going to spend money on fillers, if you're going to spend money on surgery, none of it's worth it unless you're actively treating your skin at the same time.
Wow.
Okay, so
we're in our 50s now.
Are we in our 50s?
50s, 60s. I start talking.
I feel triggered
to 50.
I'm in the 30 group still until December. So
we are starting this conversation in the 50 and 60 age group.
You're starting to bring.
They're making it's an early conversation, and they're making a long-term plan, and I love that.
I like a plan.
They're saying, okay, 5 years. I plan on what do we want to do from now until then. Skin is important, if not more important, because you want your skin to snap back and respond to that surgical procedure. I want you to kind of talk about fat for a second, because sometimes if we can do fat grafting, then a year before, we're not going to do a bunch of filler of HA in the face because it's financial, and because I would want that surgeon to replace the volume loss with the fat, which is a permanent improvement.
Yeah.
But I would say the number one thing is still skin.
So that's what I was going to say while you were talking about skin. And it's like, when you're talking about skin and the texture, tone, and all that kind of stuff, when you're going into a surgical procedure and stuff like that, what are you looking like? You can look at
you
a
mean
face
a
and
consultation?
Be like, like this is going to be a good skin, like to do a facelift for. You know what I mean?
Okay.
I think the better,
you know what I mean? Like,
the better question is, what is a problematic skin
yes
to operate on or treat? And not often, but there are some patients who just have so much pan facial aging, essentially no integrity to their dermis anymore. I mean, we're talking about super crepey
Extreme
weather.
sun damage, weather. I mean,
Mhm.
leathery. Yeah.
Yeah, those are very challenging patients because you can do a lot to them and they still appear aged.
I mean, you can pull,
But
and
you're
then,
just pulling leather at that point.
But then it relaxes back.
Yeah.
It's just like a tummy tuck.
So
you
you
can
don't-
pull as tight. If that skin is not in the best shape, sometimes it can loosen up a little bit because it's the skin texture.
I always tell patients you're not bricks and cement. Your skin, and we can get into because a lot of the buzzwords. Obviously, when you do facelift surgery, you don't want things to be under tension because that's not a durable way for things to go. But your skin is going to stretch because your face moves. It's a dynamic area. So you want the integrity of the skin to be reasonable, and otherwise they can just have not adequate results basically.
Okay, I'm
Suboptimal
55. I want to have a facelift at 60. What are you going to tell me to start doing?
I was about to say, have you been
prep
taking care of your skin
for that?
Okay, so it's a loaded question.
It's a 10-year plan.
I mean, no, seriously, that's a good question.
I mean, I think
That's
so.
you're like, that's a good one.
You want to keep up with your toxin. There's still a role for a little filler here and there based on your specific concerns. I call it kind of putting a Band-Aid on the problem until I think all the things like diet and exercise and hormone replacement, those are bigger and bigger factors. So really this conversation probably started in the early 40s in an ideal situation. But you need to be on an anti-aging skincare regimen, which is going to involve some type of vitamin A derivative. But these are your retinols. I do think there's a lot of growth factors and peptides now that are very promising, and I use them myself. So a good skincare regimen essentially is your best kind of tool at this
And the
stage.
least invasive, easiest thing is you could do microneedling every 3 months just to keep that collagen production going.
For sure.
Microneedle.
I mean, truly.
How okay, so like within your 10-year plan, you did say that you could utilize dermal fillers in that time. Is there a time frame prior to a facelift that you're just like, hey, no filler until
Yeah, so I don't know. There's no exact number. I don't want you to have any significant filler work probably in that 6 months to a year before a facelift because I don't want to be, depending on where I'm working, I don't want to be running into hyaluronic acid, which you can. And there are potential issues with filler, Sculptura and Radius and those other products in certain planes because they do cause some inflammation. Ultimately, inflammation causes some scarring. So it's not that you can't do a facelift, it's just that it can make them more challenging. So you kind of want that product to have kind of run its course for the most part.
Right. I know Kybella.
Kybella's a whole different story. That's a inflammatory hot mess.
Hot mess, and they're trying to dissect the neck, and it's just like matted. So no Kybella before a facelift.
those pictures?
So there's a lot of minimally invasive procedures that are great, but some of those, that the invasive radiofrequency can cause some scarring, and potentially make a facelift more challenging. Yeah.
Okay. So lipo with
anything that invades the dermis is got the potential to be problematic.
Yeah.
I think
possible, but
I think
harder.
RF done
Anytime you get in there, and
is excellent, and it's all about the depth because you really don't want to be treating the deeper structures of the face with it.
So I would say the next thing that we can kind of chat about is which you said earlier, just the unattainable goal. And I think I think people respect when you say, listen, I've never had somebody be like, when they come in for filler and you mention a facelift. Because you're in they want to be informed, they want the education, they want to understand, and it's a lot less intimidating than you would think for them.
Okay, I have a question. When we were talking about, you had made mention of it earlier, and I know we've talked about it a lot, like in previous episodes, but so we're talking about aging face and all that kind of stuff right now. But what about massive volume loss to the face, whether it be a substantial amount of weight loss or something like that. So maybe this isn't your aging face. Maybe this is a younger face, but let's say this face was rather large at one point and has significantly slimmed up. Is that a situation where you're going to like replace volume with filler, or is this a facelift conversation, or kind of where does it go with that? Because that's a whole different type.
That's good.
The massive weight loss patient is its own category of patient, regardless of whether they're young or old. And certainly if you lose a ton of weight, you can be so deflated that there's nothing you're going to do without surgery. But volume replacement is still going to be a big part of it. But
okay, so the neck, I would say there's nothing you can do other than surgery, right? Like on one of those patients. But what I don't like a facelift, like a neck lift, and they do nothing to their mid-face.
Yeah.
And it still looks like so gaunt.
Like a
but
tight
then
neck,
the
which
neck is
like
tight.
this.
Do you know what I'm talking about?
Yeah, I mean, I guess for me, patients will come in and talk about, I just want a neck or I just want a blah, blah, blah. And I usually
Educate.
correct. And just all these things it's not like there's a boundary that's like the platysma ends here. It's all one soft tissue envelope, and it's really hard to address. It's just like tailoring clothes. You can, if you're going to address it, you got to address the whole thing, or you're going to leave yourself with something that doesn't look finished or something that looks a little weird.
I love that.
Saggy underarm.
Yeah, but weight loss is tough. And I would say in the world of GLPs now, which is its own episode, I think, coming up, what I've seen more of is my facelift patients go on to lose significant weight. And we've talked
after?
Yeah. Every patient has heard me say, like, you need to do almost anything we do needs to be done when you're at a stable weight. There's a little play, 5 pounds or so.
Right.
But faces are super sensitive. Some people lose weight, they lose it all on their face first. But I've had the facelift for 2 lose 30, 40, even 50 pounds. And they come in with complaints that, things aren't holding up. And like, I can't beat you losing 50 pounds.
I can't.
There's no amount, so that's like a do-over. You need another facelift. So if you're going to get skinny first.
Yeah.
Get skinny.
But
the GLP-1s and then see.
Yeah, and it's not the drugs. It's nothing specific about the drugs that's making you look older. It's just
the volume.
And it's accelerated, so people see it over a shorter period of time. Instead of losing weight over 6 months to a year or 2 years, they lose it in a couple months, and it seems really drastic. But they're some of the most rewarding faces.
Talk for 2 seconds, because we're running out of time, about that patient that wants just their face. And just their neck, and that's it. What can you do to address the mid-face at the same time as fixing their neck in that GLP-1 patient with minimal added recovery?
So, I think fat grafting, almost everyone needs a little fat back in their face. The young and the old, and fat grafting has become more and more a part of pretty much every cosmetic procedure I do on the face. So fat is great for lots of reasons. One, it's yours. It's not a foreign body. You don't have to worry about the
rejection or
the things being infected or the things like you worry about more with a foreign body. And with my lower lid surgery or with my facelifts, I'm almost always adding support here. But the other really interesting part about fat is it's got stem cells in it. So there's a lot of evidence that it improves the overlying skin. Just by virtue of being there. So that is it makes a big difference.
So good.
I know. I'm really excited. So obviously we're starting to get into the surgical aspect.
I am so excited for this next
episode. I know.
episode.
I'm like, this is fun.
So good.
So we're obviously getting there. And so we're going to stop here. Dr. Gear is going to come back and join us with Dr. Weiler, because we want his input as well. I know we can fight about it.
You've changed him about all these facelift thoughts.
I'm like, I know he loves a facelift.
Yes.
Oh, he loves a facelift. He would kill us if we talked about it without him here. So we are going to do a part 2, have Dr. Gear back, and it's going to be amazing. So before we get out of here, we always do like a little summary, because like I know what we have lifted here. So it's like filler is great. Filler is a great option for a specific time,
absolutely,
for a specific structure that you have. So like it's definitely there, like for sure. But facelifts are not scary, as you'll learn in episode 2. And it's also an option, but also more importantly, finding a practice that has the entire realm, that has the aesthetic side of it, the injectable side of it, as well as the surgical side of it. So you can have that rapport and relationship for that entire journey that you're going to go on, like Taylor's patient that's been there forever. And we're done with injectables and moving on to surgery. So making sure that you find like a really good, well-rounded, got all the goods practice to kind of help you with this facial journey. But until then, Dr. Kira, thank you so much for joining us.
You're
I'm
the best.
excited.
Thank
I'm
you.
so excited to have you back. And I'm so excited to commission a painting. This is going to be great. I'm getting a whole bunch of things done today. No, but make sure you are following us. Click below, like, subscribe, follow us on wherever it is that you're listening or watching your podcast. On all the social media outlets. I know Max posted the most fantastic video of me just like broke neck last week on social. So like it's some funny content if nothing else. But make sure you're liking, following, joining us every week on the consult before the cut, and make sure to always stay curious, always stay informed, and always consult before you cut. We'll see you guys next week.